Hello everybody, I'm Dr. Bill Sterett with Vail Orthopaedics and Neurosurgery. If you're watching this video, it's because you've got a rotator cuff tear and you're wondering what are the chances that it will heal? Why don't all rotator cuff tears heal? Not all rotator cuff tears need surgery right away. It turns out in a big study, 50% of asymptomatic, meaning asymptomatic people over age 50 have a rotator cuff tear on their MRI. So just because you have a tear doesn't mean you need surgery right away. If it's symptomatic and you can't sleep at night, can't lift your arm, can't do the things you want to do, then it's time to assess the healing potential and what happens with surgery. Unfortunately, the rotator cuff, no matter what you hear anywhere else, doesn't have the ability to heal on its own. I use a lot of stem cells with surgery as an adjunct. You can't inject stem cells and expect that traction to pull that rotator cuff all the way over to and glue it down to the bone and expect it not to pull apart again. So unfortunately, stem cells are a great adjunct to surgery, but it's not a great way to avoid surgery altogether, unless you're just trying to treat the pain, because stem cells can help decrease pain. Anyway, let's talk about risk factors for a rotator cuff tear not healing after surgery. There's 3 factors. Number 1, the size of the tear. So we've classified these small, medium, large, and massive. Small tears have more than a 90% chance of healing after surgery, closer to 95% in my experience, especially if they're brand new. More than likely, that small tear, when repaired, will stay together forever. Now you go all the way to the end of the spectrum, those massive tears. What is a massive tear? More than 5 centimeters. So 2.5 centimeters is an inch. Doing the math real quick, that's greater than 2 inches in diameter. Think of it like a dollar size coin. If there's that big of a hole in your rotator cuff, it's got no better than a 50% chance of healing once it's sewn back down. Second factor that we look at is, was this acute or chronic? Does that mean, did you just do it in the last 3 weeks, or did it happen 10 years ago? Obviously, just like fractures or anything else, the more recent it happened, the better chance of healing. Something that happened 2 years ago has a much lower chance of healing when repaired than something that happened last week. And that's for the same size tear. A 15 millimeter size tear that happened last week, I can promise you is going to heal up once you get it pieced back together if you had never had a problem before. 15 millimeter tear that happened 6 years ago may not even be repairable. And the final thing to talk about goes along with that acute versus chronic thing, is how much on the MRI we see this fatty infiltration of the muscle. So if you tore your muscle 10 years ago, or tore your rotator cuff, which is just the tendon to a muscle, 10 years ago, that muscle has been firing and not pulling on anything, not allowing you to get up overhead. And so the muscle belly itself undergoes this fatty infiltration or fatty degeneration. By and large, if more than 50% of the muscle has been replaced by fat, it's probably not worth repairing it, because that's not going to reverse. You can't turn fat back into muscle. Muscle will go to fat, unfortunately, but not the other way around. So anyway, if more than 50% of it is torn, or it's a massive tear, 5 centimeters or bigger, or you did it 10 years ago, think long and hard and ask your surgeon, is it worthwhile repairing? Is it worth the 6 to 9 months of rehab to get this fixed? Also talk a little bit about some of the stem cells and PRP and things that we're using as an adjunct to try to increase those percentages. And that's what we're all desperately working on, trying to speed up Mother Nature, or help Mother Nature get this stuff to heal for us. Anyway, I hope this helped answer a little bit of your question about your rotator cuff tear. Remember, 3 things to talk about should be right below me here. I'm Dr. Bill Sterett with another one of your Sports Medicine Minutes. Thanks for listening.